Hello everyone. Once again, you're welcome to our program. That is, I already told you we will be discussing two cases in every week from each module of Part 3 MRCOG. Today, I'm going to say about an antenatal case. So, before that, I would like to say a few words about the antenatal module. All the routine antenatal care you can get it from NICE guideline, and you have to you read once at least the antenatal care from the NICE guideline, and you need to know what that the low risk, there are two groups, that is low risk group and high risk group. Low risk is managed by the midwife led care, and high risk is managed by the consultant led care. And then you need to know the communication. You need to know the communication with the colleagues, like midwife, because it is antenatal, and so midwife, GP, her GP, your colleagues from the other specialties. Sometimes she may have some medical problem, so like thyroid or diabetes. You need to consult your colleagues in that specialty. And this is the concept of multidisciplinary care. Always this word multidisciplinary care you should remember. Now, because where it involves, other than the consult, various other colleagues, experts. So now, there are some topics in the antenatal module. Commonly, you need to know, like any hypertension, preeclampsia, multiple pregnancy. Mostly, they will ask twin pregnancy. The management, it can come as a structured discussion. Also, monochorionic twins can come as a structured discussion. Mostly, they are simulated patient tasks. And then the baby can be small for gestation age. They can give you growth charts, and they will ask you. They can provide 2-3 growth charts, and you need to know what is exactly centiles and all. Then especially they will ask you about the small for gestation age and the Doppler studies also, and macrosomia, that is large for gestation age, also you need to know how to manage. And then presentations, commonly breech presentation will be asked. Breech presentation, it can come as a simulated task, whether you need to know all the options, birth options of the breech, and also that anything they can ask, either extensocephalic version or elective cesarean section or assisted breech birth, anything they can ask. They can ask on everything. So then antepartum hemorrhage, especially placenta previa, placenta accreta, and they can ask you ultrasonically diagnosed fetal abnormalities like talipes, echogenic bowel, such things they can ask. And you need to know about prenatal diagnosis also, like Down screening test. Sometimes they will ask Down syndrome also. Then screening test, you need to know about the amniocentesis, Korean villus sampling, and non-invasive prenatal testing, and preterm labor, pre-labor rupture of membranes, and all these things are the commonly asked, and which they come into your day-to-day practice also, where you come across all these people, all these type of cases you will come across, you need to know. So NICE guideline is very good for all this. And monochorionic and monochorionic twins, it is given in the Green-Top guideline also. And so, and then now coming to the placenta previa, antepartum hemorrhage, also it's given in the Green-Top guideline. Now, coming to the you need to know how to take the history, the investigations, which are relevant investigations, and you need to explain to the woman about how to manage this, manage her relationship. She usually will be coming for the antenatal care plan and delivery plan. So you need to discuss about these things, and that a few investigations will be included. Now, today we are going to discuss about an important topic, which is very important, and it is a little bit of people find it difficult also to explain and to gather information from the patient. That is a role player. So that is a domestic violence. Domestic violence is very important, and they can. It is a TOG article. It is a TOG article. You can get it from the TOG also. So now the case scenario is in front of you. Here they will assess all these three domains, mostly the patient safety, because that is very important in domestic violence. And you need to communicate with more with the patient. You need to get out the information from the patient, because she will not tell you that it is domestic violence. You have to bring out the information. There lies your skill, and take the information. So now you have to take targeted history, and if she has any concerns, usually she'll be silent. Usually she'll be silent. You have to get information from her and give the management plan. Now, this is the history case in front of you. It is a simulated patient task. Mostly it comes as a simulated patient task. You are an ST5, about to see Mrs. Maria John, 35 years, and she is at 32 weeks of pregnancy. She presented to maternity day assessment unit on a number of occasions, complaining of palpitations. This is her fourth attendance. She has been investigated for her palpitations. in this pregnancy, and a detailed cardiac assessment has been done, including the 2D echo, the 24-hour tape testing, and also relevant blood investigations. All the investigations are found to be normal. The midwife asked you to see this lady, that is Mrs. John, Maria John, as she noticed some bruises on her arms and legs. So now this is the scenario, and she has given her findings that she is 30 weeks pregnancy with a fetal heart rate same present. She heard the heart rate. So these are the things which are given. Sometimes let me tell you, it is not only the palpitations. She can come with abdominal pain. She can come with headache, any vague complaint, which on investigation we cannot find out any cause. It's just vague complaint. Commonly they cannot come like abdominal pain and such things. Anything they can come. So, but when you see bruises, the word bruises on her arms or legs or anywhere on the body, you have to think about domestic violence. That is a clinching this thing point. So now I'm starting the station like this. Hello, I'm Dr. Manjula, one of the doctors from the antenatal clinic. May I confirm your name and age, please? I'm Maria John, the 35 years doctor. How may I call you? Call me Maria, doctor. Okay, Maria, I can see that you're pregnant. Now the introduction is over. Now you're coming to the agenda. Maria, I can see that you're pregnant at 32 weeks and you have some palpitations. And so you're here to discuss. Am I correct? Yes, doctor. Do you have any idea why midwife referred you to us? No, doctor. Always anyone refers to you, either midwife or anyone, whoever refers, you need to know whether the patient knows it or not. Sometimes midwife will tell the patient why she is referring to her to the special this thing antenatal clinic. So you sometimes they will say they will know, sometimes they don't know. So even scan findings also like that. They do the scan and sometimes sonologist will tell her the scan report and always confirm whether she knows it or not. So she says, no, doctor, I don't know. Then, well, as I'm seeing you for the first time, can I gather a few details from you? Now you're going for the information gathering. Is it your first now you're asking about the details of this pregnancy. Is it your first pregnancy? No, doctor, it is second pregnancy. So, and congratulations. And have you named the baby? How is the baby moving? And I see that you're 32 weeks pregnant. How is your pregnancy so far? Do you have any pain or any bleeding or any leak? Any problem with the issues, the bladder, waterworks, or any bowel opening? And any issues with the bowel opening? How are you coping up with this pregnancy? Have you done your booking blood test? Are they normal? How about your scan? Have you done your this scan at the 12 weeks, that is a down screening scan? Yes or no, she will say. Have you done your mid-pregnancy scan? That is around 20 weeks to rule out abnormalities in the baby? Yes or no, she will say. And have you done any other scan after that? Just to make sure that whether she has gone for the growth scan or not. So these 3 scans you can ask because usually they come in the 3rd trimester. So down screening, mid-pregnancy and growth scan. Can you tell me about this part? Now the pregnancy status is over. Pregnancy details you have found, taken. Coming to the heart problem, palpitations. Can you tell me about your palpitations? When did they start? Can you tell me what worsens it? What makes it worse? And let me tell you. So she will say, when did they start? She will say how many days and all, and what thing worsens also. If anything is that, she will tell you. Now, let me tell you. I have seen all your results. I confirm your name, age, and NHS number. Maria, let me tell you that your heart rate, your 2D echo, your blood test, all are normal. I'm unable to find any reason for the palpitations. And how about your previous pregnancy? You said you have one pregnancy. How can you tell me more about it? Whether it was a normal delivery or a cesarean section? Doctor, it was a normal delivery. Then have you delivered at the date or baby came early? No, doctor. On the on the time of date only I delivered. How was the baby at the time of delivery? How was your recovery? These are the things you should ask. Then from the gynec history, you say, how about your cervical screening? Are you regular in doing the cervical screening? Yes. And have you used any contraception? No. Now coming to the medical history. Are you on any regular medication? Do you have any bleeding problem like bleeds? Do you bleed easily after any cut or an injury? Because she has bruises, you need to know. Don't straight away think it is domestic violence. Rule out bleeding problems. Do you have any allergies? So, can you tell me your blood group? Because she has done the booking, they must have done booking blood test, you need to know. Booking blood test and blood group. And if need arises, will you accept blood or blood products? You want to rule out Jehovah's Witness. Now, coming to have you undergone any surgeries in the past? Any operations in the past on your tummy? Tummy is important. So, in case she needs a cesarean section, if she has previous surgeries, it can become there can be some complications like additions and all during cesarean section. Now, any family history of any heart problems in the family? Because she has palpitations. You just want to rule out any organic lesion in the family. Now, can you tell me about your personal habits? Do you smoke or take smoke, alcohol? 111, you ask. Pardon me for asking, any drugs? And so then, if BMI is not given, you ask, can you tell me your BMI or height weight ratio? You can ask. Then, what do you do for living? And how is the support? How is the support? Support is important here because you're suspecting domestic violence in your mind. You have to find out the support. Can you tell me how is the support at home from your partner? How is the support from the partner? How is the support from your family members? How is the support from your friends? Do you have friends? And how about the financial part? What about the financial aspect? Can you support your child? Do you have enough of financial support for you and your baby? This is about the information gathering. So support is very important. Why? Because domestic violence means that she may not be having some support from the family. That is why. So would you like to add anything? Always close the information gathering with this last question. So now that's over. If you permit, now examination. If you permit, I'll ask my midwife to check your blood pressure and pulse rate. Every visit you have to check the blood pressure, pulse rate. I will arrange a scan for you to see baby's growth. Now Maria, so that is over. Now already midwife examined the baby's heartbeat. So you need not check the baby's heartbeat. That means you're suspecting her findings. So no need. Now coming to the discussion. That is clinical knowledge. Now Maria, our midwife has examined you. And she says, your baby is fine. Baby is doing well. That means she has written the heartbeat, yes. Baby is doing well. But she has some concerns. Because she noticed some bruises on your arms and legs. That's why she's concerned, and about which we are going to discuss, Maria. Before that, let me assure you, whatever we discuss would be confidential. No one will have any access to it. Now, have you heard something about domestic violence? No, doctor. See, it is quite common, Maria. It is very common. 1 in 4 women undergo domestic violence, and it is unacceptable. Domestic violence usually starts in pregnancy in 1/3 of the cases. Almost every 1 out of 3 patients, they will have this domestic violence. Though help is available, women find it very difficult to speak about it. Maria, what I have been informed and what I have seen, I'm really concerned about you and your baby's safety. You have come 4 to 5 times to the hospital with palpitation. But we could not find, and we have done everything, all the tests we have done, we could not find any reason for it. Because because bruises, the bruises do not, you have to think about, because bruises with no history of any organic heart lesion, that is palpitations. So that means it is domestic violence. This is for you, not to the patient. Is everything fine here in your family? How did you get these bruises? Would you want to say anything about it? Once again, I want to tell you, Maria, it will be confidential. Then slowly you bring her into the conversation. She will cry or start saying, my partner abuses me, doctor, physically. Slowly she will say, I'm very sorry, Maria, to see you in such a difficult situation. We are here to support you. Does anyone know does anyone know about this? Did you tell anyone in the family or to your friends? Have you told anyone about this? She will say yes or no. See, you say, domestic violence is unacceptable, Maria. No one deserves to be treated like this. Now you're not alone. You have your baby with you. And now you talk about the domestic violence, how it is. Since how long is this happening? And then you have to say 3 type of domestic violence: physical abuse, emotional abuse, sexual abuse. How will you ask? Does your partner hit you and beat you anytime? That is about the physical. Or do you feel humiliated? Or does he hurt you during sexual activity? Does he carry any weapon? And does it threaten you? See, if she has, she has a kid at home. This is a second pregnancy. And is your kid, ask about that also. Is your kid or is at risk also? Does he beat your kid also? Do you think your life or your baby's life is in danger? If she says yes, do you feel safe at home? She says, no, I'm not safe. Or if she says her life is in danger, then you say, you can always inform the police. Whenever there is risk to her or her baby, that is one baby she has at home. If they are in danger, then she can always call police. Now, let me tell you what you need to do. There is one thing called something called escape plan, Maria. See, that is a escape safety plan. See here, you have to come out of this situation because it is for you and for your baby safety. We can come up with a plan. You can always you can keep all your documents, your bank details, checkbook, credit card, keep everything in a bag and keep it in a safe place, and you can keep it in either with your parents or with your friends, or any family members. And whenever you feel you're unsafe or whenever you feel you're facing a dangerous situation, then you can leave this immediately with this. There are some charities and agencies who will help you. Am I clear, Marias? Am I clear? Yes, there are some charities and agencies who will help you, like Women's Aid and Women's Refuge. They will help you, Maria, to make safety plan for you. They'll make a safety plan for you and for your child. If you want to leave this, any time, if you want to leave this abuse relationship, there are some safeguarding agencies, some social services. They are there to help you. I shall give you the 24-hour contact number. Will that be fine? Yes, doctor. Now, then I'll give you this 24-hour contact number of National Domestic Violence Helpline. You can write on a small paper and hide it in some safe place. You can write it on a lip balm also. They will help you find some safest place for you. Say, and then they're free of cost. I'll put your name, and the other thing which I will do for you is I will put your name in multi-agency risk assessment conference. That's MARAT, where they will all the highest case of abuse are discussed between police, people from child protection, and in their independent domestic violence advisors. So they will discuss about it and they'll find a solution for that. Will that be okay? Yes, doctor. No, Maria, apart from this, I want to tell you about your pregnancy care also, because I'm concerned about your pregnancy. Domestic violence can affect the pregnancy. So, shall I explain to you? Yes, doctor. It's a high risk pregnancy, and so you'll be under consultant care. You'll be under consultant care. You need to come several times, that is, more visits, frequent visits, and we need to do frequent scans to check baby's growth because it can affect the baby's growth also. See, because of the domestic violence, the baby can be small, baby can come early, or sometimes what happens, there can be some issues during pregnancy. So the baby can come early. Sometimes what happens, the baby's heartbeat can stop when the baby is inside the womb only, before delivery. And sometimes what happens, after birth can separate before the baby delivers. So these are the issues which can happen to the mom and the baby. So it is a high risk pregnancy, and then later on, after the baby is born, in future the baby can have behavioral problems. So we need to take care of your health and your baby's health. Now at the 36 weeks, your mode of delivery will be discussed by our consultant. You can have normal delivery, but if there is any problem at that time, and then you may have to may have to do a cesarean section. And you will be taken rest. Let me tell you, you will be taken care throughout your pregnancy, throughout your delivery time, and also after the delivery. You and your baby will be taken care of. Am I clear? Yes, doctor. So I will document I'll document all the injuries in our which we have seen, and also uh, um, so then I will document all your injuries in our hospital copy, not in your hand notebook. Okay, and also your care will be taken care by a team of doctors. Let me tell you, that is our consultant will be taking care of you, and also sometimes we will take help from the counselor. The senior midwife will be there, And then we need to take, because of the scans, we need to involve our imaging doctor also. They will take care of you. The baby doctor is there throughout in the delivery time, and after the delivery also, baby will be taken care of. So these are the doctors, team of doctors who will be taking care of you. Am I clear? Okay. Now I will speak to my consultant about you. Then I will let the next appointment we will keep a longer slot for you, so that you will have more time to discuss about all your problems. And if you wish, we can now today. If you wish, if you feel unsafe, we will admit you today. What do you say? No, doctor, I want to go home. So okay, then if everything, if everything is fine, then we will send you. But it is we'll make sure that everything is fine for you. So anytime you need, you I will give you 24-hour contact number. Anytime you feel unsafe at home, then you have to come here. That, or anytime you feel pain or bleeding or any leak, or you feel baby is not moving, I'll give you the 24-hour contact number. You can come to immediately to the accident emergency. And if you permit, I will give your information. It will be, I will, to the your GP and your community midwife also. Because it is better if I inform them, so that they will take care of you. What do you say, Maria? Okay, doctor. Now, I'll document whatever we have discussed, and then I'll arrange a scan for you today. This is the information leaflet that is about about what we have discussed. And so I will also give the telephone numbers which I told you on a small slip of paper about the Women's Aid, Women's Refuge, and National Domestic Violence Lines. And your delivery, after the delivery also, I told you will be taken care of. You can breastfeed your baby, and then we will, that time your baby doctor will be there to take care of you, and you will be under continuous care. So, and then would you like to add anything? No, doctor, this I haven't got it. So, then this is the way we are here to help and support you throughout your pregnancy. Now, I will thank you for, thank you so much for opening up to me. So, we'll meet next time with our consultant. Okay, thank you, Maria.